Hola amigos, ¿cómo están ustedes? How are you today? Today we have Dr. Goldner with us, Associate Chief Medical Officer of Lehigh Valley Hospital, Pocono, to talk about the latest news of COVID-19 here locally in our community. Hola, hello Dr. Goldner, how are you?
Pretty good. How are you doing?
I'm fine, Dr.
Thanks
Goldner.
for having me.
No, thank you for being with us because I know that you're very busy and we need to have the latest updates and answers that the community wants to know about COVID-19 locally.
Mm-hmm.
So thank you for being with us. Well, you're Associate Chief Medical Officer. What does that mean? It's a very interesting thing.
Sometimes I think about that on occasion, but besides a practicing internist where we take care of older adults, I also do some hospital administration. So my job is working underneath the Chief Medical Officer, who's responsible for the medical care and quality and things like that in the hospital. So I assist him, and is my biggest role in helping.
Yeah, thank you. And first of all, I want to thank you and all the people in the hospital, all the workers, for all the work and under the stress they're going through. So thank you so much for doing this work.
For noticing that. We appreciate it.
And I know that our community thanks too. Here we have some questions that we gathered from the community, and if you're okay, we're going to start with them. And these are questions directly that our community wanted to know. So let's start with, what do I do if I think I was exposed or have symptoms of COVID-19?
Sure. Again, that's a really good question and an important one. Certainly the first thing is to self-quarantine. And that means, staying at home, having a mask on. If you live with other people, they should have a mask on, you should have a mask on. And you want to stay socially distant from them. That means over 6 feet. You want to be separated, so have your own bedroom. We prefer you have your own bathroom if that is possible, and not to share utensils. I would also advise that you should get tested if you have symptoms but not sure whether you may have it or not. If it's just an exposure, usually we ask people to wait 5 days before they get tested. If they go too early, then there's a higher chance of a false negative test. So waiting that 5 days is really important, and then get tested after that. If you do have symptoms at any time, you should get tested. And that means calling your primary care provider, like your doctor or nurse practitioner, whoever does your health care. You could also, if you don't have one of them, because they can order the test. If you don't have one of them, you can go to any Lehigh Valley Health Network Express Care and get tested there.
Do you need a referral for that or not?
If you're just going to go to get a test, you need a referral. You need an order, and your primary care provider, your doctor, nurse practitioner, physician assistant can put that order into the computer system for you. That you can just go there and the nurse does the test. If you don't have a primary care provider, my advice is just go to the Express Care. They open from 9 a.m. to 9 p.m. and any of the LVHN Express Cares you'll be seen by a nurse practitioner. That nurse practitioner, if they feel that you qualify for that test, will have that test performed right then and there.
Without a referral then, in that case? Correct? Okay. Now, next question. Where do you recommend getting tested? People are having trouble finding places. I know that you said the express cares, but I've heard people asking me, like, where can I go? I have to wait a few days. Everything is booked online. What are your recommendations?
Again, you can go to any LVHN Express Care, and you don't need an appointment. You can just show up there from 9 a.m. to 9 p.m., and they will see you and do the testing there. They've been very busy. Really, a lot of patients have been coming through with symptoms of COVID-19, so there may be somewhat wait. Your other option is any of the pharmacies like CVS, Walgreens. You can also get tested there. It's varying how much time it takes for one of those test results to come back. Anywhere from, usually it's about, I would say, 3 to 5 days right now. It was 5 days and over. It's come down a little bit recently. And sometimes some people have been getting it back, sometimes even as little as 2 days, which is nice.
Thank you. That's good to know. Is there a cost in getting tested, or is it covered by insurance?
Another great question, because that's on a lot of people's mind, and a lot of people don't want to get tested because they're afraid they're going to get a bill. If you have symptoms of COVID, you can get tested, and there's no charge for that. It may go to your insurance, but you should not be charged a copay or any other fees associated with getting tested if you have symptoms. If you don't have any insurance, then it's covered by the federal government through one of their acts that will pay for that test. So there would, again, be no charge to you. Now, if you do have symptoms, I'm sorry, if you don't have symptoms and you just want to, maybe you had exposure, some people want to travel, that sort of thing. And I don't advise traveling right now, just to let everybody know that. But if you don't have symptoms, you can still go to any of the express kits to get tested. But you can also go to the CVS and the Walgreens or Rite Aid, whatever. Insurance, you may have a copay, you may have some other fees that possibly if you have insurance that would come about if you don't have symptoms.
Thank you. What should you quarantine while you're waiting for your test results, or isn't it necessary?
Another great question. If you think you were exposed or you have symptoms, the answer is yes. You want to self-quarantine until you know your results. And I'll be honest with you, even if you were exposed, say you had a friend and you were with that friend and it was a significant exposure, maybe you were eating together, didn't have your mask on, maybe you're within 6 feet of that person, and that person tests positive, and then you have what we call a high-risk exposure. And so you would self-quarantine, you would get tested. Usually we wait till like day 5. If that test is negative, you should still quarantine. That does not negate your quarantine. So obviously, if you test positive, then you have COVID-19 and you need to quarantine because of that. The CDC has just changed the guidelines so that if you have a negative test from an exposure, you can stop the quarantine after 7 days. So if you don't go for a test and you had an exposure, then you want to quarantine for 10 days. It just gives you that more time.
And what if you have an indirect exposure and you are living with your family? Does your family have to quarantine too? Let's say, I'll tell you what happened to a friend of mine. So her husband one of his employees had been exposed to somebody that was positive. The employee had to quarantine, was in quarantine, right? He went to quarantine. His wife locked him in the bedroom and let him out for 8 days. But she didn't know what to do with herself and her kids. Did they have to quarantine? So that's a very indirect exposure. By the way, they were all negative at the end, but still.
Yeah, it's just a slight thing. You knew somebody at work who had it or something, and you never really had any contact with them. I don't think you really have to quarantine in those regards. If you had a contact that was what we call high risk, that means that you were with them for over 15 minutes without a mask on. If you were within 6 feet of that person for over 15 minutes, something like that, touching, hugging, that somebody that was positive, then that's a high risk exposure. You definitely need to self-quarantine on something like that. We all get a little paranoid, and so if there's just you knew somebody who knew somebody, I don't think you need to quarantine on that. If it was you really didn't have any contact with them, it's probably not necessary.
Yeah. How do we keep the balance of not getting so crazy about the exposures? Some people are not vigilant enough, and some people are too vigilant, and that drives them a little bit crazy, Nati, right?
Yeah, we all get a little bit obsessive after a while, and we find the opposite happening, that people get I would call it COVID-19 fatigue, and so they get a little bit lackadaisical about contacts and being with other people, and I think you have to be very careful about that. You'll always have the people that are so afraid and paranoid and fearful that they're going to contract it, that they're overdo it. That does happen. I think we just have to be, mindful of that. You're always going to have people on either side of the spectrum, but we're seeing more people on this lackadaisical kind of part of it than those who are actually overcautious.
Yeah. And what would you say for those that have to travel or take a plane? What would be the best precautions? Do they have to?
Don't do it.
Don't do it.
I really think this pandemic, this surge that's happened now on the second wave here, or third wave as some people are calling it, is very serious. There's a lot more people that have contracted it. Yes, we're seeing less deaths, but we're still seeing people die from it. And my thought is, I don't think it's worth anybody's life. Obviously, if there's an emergency and you have to travel and get to someplace quickly, I understand that. But I think if you're going on vacation, and even because of the holidays here, if you're going to go see family, I would postpone it. I just don't think it's worth that risk to your health and your family's health. And all you need is an exposure to yourself. You get sick, and then you're going to give it to other people. And it's just not worth it. just isn't.
I understand.
You know, as far as if you have to travel, if you have to, I would say you mask up. Don't take that mask off. I would wear safety goggles on your eyes, like safety glasses, and I would have gloves on and hand sanitizer. I would try to, if you're, you know, I know some airlines are trying to sit people by themselves in a row, but other airlines they're actually trying to pack people in as much as they can. And you may very well be sitting next to somebody and you don't know anything about them. You don't know if they were exposed, positive, negative. Don't really know. So I think you're taking a risk if you are traveling.
You're right, Dr. Goldner. I'm from Spain, and I haven't been in Spain since the pandemic, and I'm not going to go until this is under control.
I think it's going to be, you know, next year it'll be better, without a doubt. You know, they have the vaccine coming now, and I think we're going to see changes in within the next 6 months to a year, and hopefully next Christmas will be a lot nicer than this Christmas, which will be, you know, very simple for a lot of people, unfortunately.
I know. Let's talk about the vaccine now. Let me see if somebody's asking. We're hearing a lot about the vaccine coming soon. Do we know when it will be available to the public here? The question, the elephant in the room.
Yeah, and you know, and we don't know. I don't know who knows. We actually don't even know about our own cells. We hear that we're going to get 50 doses delivered tomorrow at the hospital, and it's going to start coming in dribs and drabs. You know, 50 doses is not that much for all the healthcare workers that function in this institution. But at least it's a start. We know every week it's going to be more and more, and we'll be able to get people vaccinated. I know healthcare workers and those who reside and work in nursing homes or extended care facilities will be the first to get vaccinated. When it will be available for the general public, I'm not sure, and I don't know if anybody really knows that yet. We're still not even sure, you know, how fast we're all going to be able to get vaccinated here. So,
do you know what kind of vaccine we will have?
I mean, which company makes?
Yeah.
No, not at all. Right now, it's Pfizer and probably Moderna will have their vaccine authorized this week. You know, the advisory committee is meeting, I think, on Thursday again, and I assume they're going to pass that one because it looks about as efficacious as the Pfizer vaccine, which is really good.
What would you tell within Hispanics? Also, we don't like needles, and many Hispanics are about.
Yeah.
I've heard.
It's important, though. I really do think that will make the biggest difference with people getting vaccinated. And, you know, a lot of people are scared about getting vaccinated. You know, is this a safe vaccine? And yeah, those are valid concerns. You know, they have rushed this through. Luckily, they have the technology nowadays to rush it through, which they didn't have up until recently. But, you know, we do know that people, you know, die from COVID-19. You know, as a physician, I don't know of anybody personally that has died of a vaccine. And I think that there's certainly more risk of getting COVID and dying from that than there is from getting a problem from the vaccine. I won't doubt there's the few that will have, you know, serious side effects from the vaccine, but they will be few and far between. We do know that there are a lot. I would say a lot of people do get some like low-grade muscle aches and just don't feel very well for a day after the injection, and especially the second one. So if anybody's gotten the shingles vaccine, it's very similar to that, which is a 2-shot immunization as well. And it's usually the second one that people just don't feel well. They have a low-grade fever, they feel somewhat achy, like they have a little bug, and then it just goes away within 24 hours. And they do recommend taking something like Advil or Aleve or Tylenol, you know, an hour or so before you get the vaccination, which lessens the side effects of it.
That's good. What do you think? Well, do we have these side effects with the vaccines? What does that happen? The side effects of the vaccines.
Okay, I think like the side effects will be minimal for the majority of people. You might get a sore arm, you know, something like that. But generally, the most common side effects are just like some low-grade muscle aches, some aches and pains in the joints, maybe a slight headache, a low-grade fever like 100, 100.2, and all these things will go away within a day or so. They do recommend taking Advil, Aleve, or Tylenol for several hours before the injection, which seems to help a lot of the symptoms.
Yeah.
So I think it's generally a safe vaccine. I don't believe they've had any serious side effects. They have not studied it on those people with allergies, so they're a little bit leery about if somebody has a big allergy history about getting the vaccine. There's been some warnings. It's also not been tested on children. So it's stated for the vaccine is to be given to those who are 16 years old and up in age. There's nobody less than 16 that should get the vaccine right now until they've tested it further.
So the children, you're saying, are not going to get the vaccine? That was
Right now, it's not been approved for them. So that may be coming about as time goes on and they're able to study it a little bit more and do some trials with children. But right now, the studies that were done were only on adults.
Mm-hmm. And what about if somebody has had COVID? Do they still have to get the vaccine?
I believe they're recommending that they should still get the vaccine, even if they had COVID.
Do we know how long does the immunity?
No, it's right now in the initial studies, it looks like the immunity is longer lasting than they initially thought, which is good. As time goes on, they will actually continue to test some of the people that have been vaccinated to make sure their antibody levels are up high enough and stay high. But it may be that it's going to be a necessary vaccine every year, like the flu vaccine. And it may be that it's every couple of years, like a tetanus shot, which is every 10 years. We don't know that, and I don't think the manufacturers know it either until it's been studied further.
Or a few times a year, maybe, or not?
I don't think it'd be that. It would be odd. It would be more common than once a year. I find that hard to believe, but I think anything's possible. But I think it's going to be maybe yearly or higher as far as the time interval.
And now the magical question that everyone wants to know. Once I get the vaccine, if I get it, I don't need to use a mask, I don't need to social distance, I can have my normal prior life?
They do recommend, even if you do get the vaccine, you should wear a mask, because again, there's just not been a lot of study. There was 40,000 plus people in the Pfizer study, went through the entire phase 3 trial system, but they don't know long term are these antibodies going to last. So all right, you got the vaccine, and then say a year later the antibody levels drop in your body, and then you're at risk, and you're at risk then for also spreading the disease, or the infection. So my thought is, at least initially for now, people should still wear a mask even if you got vaccinated. So just until they know more, I think that's important. And socially distant, hand sanitizer, that sort of thing.
Do you think that we will be able to hug again someday and not wear a mask?
I do. I really, we're all social beings, all of us, and this really hurts a lot of us. I mean, I love being with my family, and there's, especially around the holidays, there's nothing harder than to say we're going to have to put this off till next year, and that's just the same. So we just want to make sure we're all here next year, and that's one way we're going to do that, is to decrease our risk. And we certainly don't want it spread around, and it's important to just keep those holiday gatherings down to just a few people.
Yeah, thank you. Is there anything else you want to say, and a note of hope, of light to this winter, this long winter that just started?
Sure. I actually want to say two things. One, I want to thank all the nurses and the physicians and the healthcare providers here that have really gone above and beyond caring for people. It is humbling to me to see what goes on every single day here, and nurses going into rooms, with isolation, gear on, and even though you're going in a room and you have this gear on, you don't know 100% sure, is that going to protect me, or am I going to take this home to somebody? And day in, day out, the doctors and nurses and advanced care professionals go in there every single day and care for these people without knowing entirely that it's safe for them. So I have to give a lot of credit to these people and to thank them for all they do. And it's a wonderful thing to see, and it's amazing. I've seen when we were really strapped with so many patients, and it's been a little bit better this surge, as opposed to the first surge, where we just had nurses coming in working double shifts, coming in on their day off, just so they could help out and give care of patients. It was really amazing to see. And the only other thing, I just want everybody to please, we don't want our system, our healthcare system, whether it be here or anywhere in the United States, to be overwhelmed. And certainly, just like any other institution, we are tight for beds, and it's just because we have a lot more, ill people now because of the COVID-19 crisis. But I think if everybody does the right thing, such as wears a mask, and that doesn't mean just putting it on and it's below your nose, and putting it on the right way and covering your nose and your mouth, and maintaining that social distance, using hand sanitizer frequently, avoid going out when you don't need to go out. It's it's hard not to do certain things, but it's just sometimes not worth that exposure to you to go out. And and the holidays are here, and everybody wants to be together, and I know that, and it's hard for me too. But I just think that it's just, again, not worth that risk. And if we put it off a year, hopefully we'll be here next year, and we can just celebrate then, even a bigger celebration than there would be this year. So just got to wait it out. I think get vaccinated if you can, and as fast as you can, and that will also help. So those are my two big messages.
Thank you, Dr. Gollner. I wish you a happy holiday, and I want to thank all of you again, for all the health workers that are, are day after day with all the stress working to keep us healthy and to help those that are sick. Thank you. And with those two notes, I remember small gatherings, right? We can be in Zoom like we are now, and we can connect with each other, and let's be safe until next year.
Thanks, Christina. Thanks for having me on.
Thank you, Dr. Gollner. This interview is in English. Christina Luna with all of you, and we will have a summary of this interview in Spanish for our Spanish-speaking audience. Thank you, Dr. Gollner.
Thank you.
Happy holidays to you too.
You too. Thank you.